Welcome back to Houston Life. From nasal spray to pills, humidifiers, and more, medicating sinus symptoms year after year isn't only bad for your health, it can also add up and get very expensive.
Yeah, it can. And we have Dr. Robert Palmer and Melinda Morton with American Sinus Institute here to explain. Hello, guys. Melinda,
Hello.
first of all, I want to start with you because I think when you start doing the cost analysis and go, whoa, a lot of folks think doing the over-the-counter medicine is the cheapest route to go.
Correct. They assume that, and it isn't always the right solution because you're constantly having to buy these medicines. They're not working, so then you're changing medicines, and you're really not solving your problem.
The average person spends, what, $780 a year on meds?
Correct. Plus, you know, you're liable to miss out on work, so you're missing out on paid days, and it really adds up.
What about all the coffee you have to buy?
And all the coffee you have to buy.
make up for lost sleep? Seriously.
Right? The sleep you miss out on. Yeah, I mean, everything has a price, and it all adds up to that.
Now, you're the billing manager, Melinda, at American Sinus Institute. And so when people come in, I mean, I think people out there who may want to do something about their sinus issues, but they think, okay, having a procedure done is not going to work for me because it seems out of my budget.
Right.
You guys work with everybody, right?
Yes, we work with every budget, every price range that we can. We don't want that to be the reason why you don't have your surgery, because it will help you.
Well, and Dr. Palmer, I would think that if somebody's using, say, nasal sprays, I've always heard you're only supposed to use them like 3 days. If somebody's using them chronically over and over and over, doesn't that start to do some damage?
Well, the pseudoephedrine, it's a cardiac drug, really. And same with the pill you take. So it can adversely affect your heart, cause arrhythmias, cause high blood pressures. So you really can't take those on a long-term basis.
So it's more than just the sinuses of what these drugs can do to your body.
Exactly. And so many people take so much over a year period, they can have side effects. It's a quality of life issue, and what we offer changes that.
And as Jennifer mentioned, I mean, the yearly cost, again, of just the medication alone is huge. We can see on the screen, there's an example of Sudafed, Benadryl, nasal spray tissues, the sick days that you mentioned, Melinda.
$68 a year on nasal sprays?
Right.
Wow.
Nasal spray is expensive.
Expensive.
Oh, yeah. Even if you go to like a big box store and try to get the multi-pack, it still adds up.
Expensive.
So let's talk a little bit about the procedure, Dr. Palmer. And you've explained this before, but this is something that you guys do in the office, and typically people are back to work the next day, right?
Exactly. It's a quality of life issue. People that have allergies and have all the symptoms of the headache, and they can't breathe and they can't smell and take all these medications, it's just their quality of life is not very good. With this surgery, what we're doing is we're reestablishing ventilation so they don't have headaches. We help them breathe so they can smell, and now their quality of life is so much improved, even if they have allergies, that they don't need to take all these medications.
It's just one down day, right? The day you go in for the actual surgery?
Exactly, one down day.
So we have a video of the animation, and Doctor, if you could just sort of talk us through what we're seeing.
Essentially, this is a little device that has a balloon in it, and we essentially go into the normal ostia. And once we're in there, we dilate it. So the ostia can only be maybe only a millimeter, and we make it 5 millimeters. So now it ventilates.
What is the ostia in there when we're looking at that? Is that like
It's just a little opening into the sinuses. You have 8 sinuses, and those small openings get blocked because of congestion. We dilate them, so now they ventilate all the time, and they don't fill with fluid. And we also shrink the turbinates inside the nose so you can breathe. And then you get rid of the headaches, the pressure, and recurrent sinusitis.
And patients say they get relief like fairly quickly, like right after the surgery.
Right after the surgery, in 7 days, they're feeling 100% better.
Which means you're going to sleep better and all this other stuff.
And your nose is not packed, and you can go to work and the next day or the day after.
I just want to be sure we get this point and underscore what you just said. So within 7 days, then, people can see results, and that continues for how long?
Hopefully forever.
Hopefully forever. That's the goal.
Yeah.
Exactly. We're trying to reestablish ventilation because people have allergies, don't have ventilation. When you don't have ventilation, your sinuses, you retain fluid, you get infections, and you get headaches, and you feel bad.
And you are put to sleep for a little bit while you're doing this. You're not awake while this surgery's going on.
I recommend that they go to sleep so we can do all 8 sinuses and also treat the interior of the nose so people can breathe.
And then one day down, and then you're better.
Well, and again, looking back at the numbers, I think that this is something that is going to be sort of an aha moment for a lot of people. When you put everything out on the table and you see the added cost in your pocketbook,
Well, average is $780.
Yeah.
yeah, so if people
about
are no
average.
longer spending this.
Long term, you're saving money, but more importantly, your quality of life has improved 100%. So many people go around with these symptoms all the time, which I would never treat because we didn't have the balloon sinuplasty.
Well, not doing more
We
damage
turned
to the
them
body.
down. Exactly. So now we have a whole population of people that really feel bad 6 months out of the year and are spending a lot of money for therapy with over-the-counter medications or seeing their doctor, which adds up. And we have a procedure now that can
Resolve that.
eliminate all
Well,
that.
and for a lot of people, some of these symptoms we're seeing on the screen right now, like facial pressure and headaches, some people may have chronic headaches and not even realize that sinus issues are to blame.
Correct.
Exactly.
And they don't, you know.
They think they may have migraines.
Well, and we're almost out of time, but very last words. For people who are afraid of having any procedure done, is it painful? Is it uncomfortable once you're in the office?
No,
No.
you're asleep for this.
Yeah.
There's a little bit of discomfort afterwards. Some people have a headache. Some people may have a little burning sensation for a few days, but nothing like endoscopic sinus surgery that we did, you know, for
Years ago.
and we still do for certain patients who have significant polyps.
Oh,
Okay.
how things have changed. It's a great procedure, and thank you both for stopping by, Dr.
Yeah, thank
Palmer.
you so
and,
much. Now,
good to see you all.
make sure everybody knows how to get in touch with you guys. To schedule an appointment with American Sinus Institute, you can call 713-BALLOON. That works out to be 713-225-5666, or visit americansinus.com.
All right, easy enough. Thanks so much, guys. And coming up after the break, the week-long wine and food event in the Woodlands is happening